Hi, I'm Mark Olives, and today I'd like to give you just a quick word on medication. Now, I know I'm a physical therapist and medication is outside my scope of practice, but this is very important and it's just a very general rule that I think is extremely helpful and most people don't know it. And that is that 3 medications or more, when taken, you cannot predict their interaction and consequently you cannot predict side effects. When I was working in the hospital, I used to sit on a committee. The committee involved pharmacy, nursing, physical therapy, physicians. And this is where I learned this important fact. When we would admit people, or when you admit patients, it's very important to look at medications because they're often the cause of the symptoms. So you can come in with all kinds of things that'll look as though it's presenting as a certain disease. Well, turns out it's just those meds interacting. So when you take 3 or more medications, and unfortunately a lot of people do, you have to remember if you're having a side effect, you can look that medication up. You can look up all your medications and you think, well, no, I have no side effects from any of these, or none of the side effects are listed of the things I've got. It doesn't necessarily have to be. It might be, again, some interaction of those drugs that's causing a special problem. So just keep that in mind when you're taking medications. Always ask your physician, hey, I'm having these symptoms. Could it be due to my medications? Oftentimes it may not be, but it's just good to keep that in mind because at your good geriatric hospitals, the first thing they do when they admit people is they take them off of all but 3 medications. They're all stripped away. And then they look at them and they see how they behave. Sometimes the symptoms are gone, problem solved. Sometimes not. But just a little piece of information to think about because I know the pharmacologics are very prevalent out there and I think this is good information to have. I hope this helps you out. Thanks.